Most people believe that if a doctor recommends a treatment, it must be safe. The tests are done, the prescriptions are filled, just follow the plan. I used to believe that too until I started counting the people who trusted every word, every protocol, and came out shattered, not better, destroyed, changed forever. A man who followed the routine for his heart and ended up in the ICU, barely recognizable. A woman who stuck to every guideline and lost 6 months of her life to complications nobody warned her about. Months of strength, independence, memories gone. Here's the truth nobody tells you. The older your body is, the harder it fights. Not the disease, but the treatment itself. Medications that seem harmless can crash kidneys. Procedures that seem routine can steal months of life. And even when everything goes as planned, your body may never be the same again. These are decisions that carry hidden risks, silent dangers, consequences that can destroy your life, quietly, invisibly, and permanently. Most doctors don't fully explain this. They won't. And that's why you need to hear it now before it's too late. I'm Dr. Michael Kent. I've spent over 2 decades in hospitals watching patients make choices that seem safe and watching their lives change forever. I've seen firsthand how age doesn't just slow the body, it magnifies risk, amplifies consequences, and punishes decisions that younger bodies shrug off. Today, I'm going to tell you the truth about 5 medical decisions. Decisions that seem right, but I'd never let anyone in my family make after 60. Decisions that carry silent, hidden dangers. Decisions that can quietly steal independence, months, even years of life, all while everyone around thinks everything is fine. Think of it this way. You wouldn't stress a brand new car the same way you'd stress one with 200,000 miles on it, right? And yet, medicine often treats a 70-year-old body the same way it treats a 40-year-old one. Same. Medications, same procedures, same recovery expectations, but the older body, it's a fragile machine, and every choice matters more than anyone wants to admit. Here's the truth nobody tells you. As we age, the body's defenses don't just weaken, they falter in ways that aren't obvious until it's too late. The heart struggles to keep up. The kidneys slow down, struggling to process even standard medications. The lungs take longer to clear treatments, leaving patients vulnerable. And the brain can spiral into confusion, disorientation, and memory lapses that last weeks or months. Doctors call it post-T treatment cognitive dysfunction. But for families watching, it feels like the person you knew vanishes. Age itself isn't the enemy. I've operated on patients in their 80s who bounce back faster than some 50-year-olds, but frailty is real. Frailty isn't a number on a chart. It's the body saying, I'm running on borrowed strength. Roughly 40% of people over 75 show signs of frailty. By 85, nearly 60% do. Here's the hard part. Most people only hear about survival. Will the treatment work? But that's only half the story. The real question is, will the patient survive the aftermath? Because surviving a treatment doesn't mean life goes back to normal. Surviving the treatment is just the start. Decision number 1, following aggressive heart treatment plans without questioning alternatives. Everyone assumes that if a cardiologist recommends a certain protocol, especially for heart disease, it must be the right path. Tests are done, medications prescribed, procedures lined up, everything looks neat, professional, controlled. I used to believe that too until I started keeping track, counting the patients who trusted every instruction, every guideline, and came out permanently changed. Not better, changed, broken in ways nobody warned them about. A 72-year-old man followed every pill, every lifestyle adjustment, every checkup. 6 months later, he was in the ICU with severe kidney failure triggered not by the disease but by the treatment itself. Another patient, a woman in her late 60s, stuck to every heart guideline. 6 months later, she wasn't just exhausted. She had lost months of her life to complications nobody prepared her for. 6 months. She'll never get back. Memories she might never recover. Here's the brutal truth. The older your body, the harsher the impact of treatment. Not just the disease, the treatment. Aggressive regimens can overwork the kidneys, stress the heart, inflame the liver, scramble the brain. Organs that younger bodies shrug off suddenly fight for survival. And most people never hear this. Doctors focus on curing the disease, not protecting the patient from the treatment itself. Ask yourself this: are there gentler paths, less invasive options that protect the body while still treating the condition? Sometimes the safest choice isn't the boldest one. It's the one that respects what your body can truly handle. Decision number 2: elective joint procedures and aggressive orthopedic interventions. Most people think if my knees hurt or my hips are stiff, a replacement will fix everything. It sounds logical. Painful joints, limited mobility, surgery seems like the guaranteed solution. But here's the truth: I've seen over and over with patients over 60. Elective doesn't mean safe, it means planned. And a planned procedure can still destroy months of life if the body isn't ready. Take a 68-year-old woman. She had both knees replaced within a single year, followed every instruction, prepped herself perfectly. Post-surgery, she developed deep vein thrombosis, then a pulmonary embolism. Weeks later, she could barely walk. Her life, her independence, temporarily stolen. Another man, 74, had a hip replacement without proper prehabilitation. His heart struggled under anesthesia. Pneumonia set in. 3 months later, he was still in rehab, weaker than before he went in. Elective doesn't mean harmless. Your older body resists trauma, blood clots, infections, heart strain, lung complications. These aren't minor inconveniences. They are life-altering consequences waiting silently in the wings. And too often, patients never ask the crucial questions: is this the best moment for my body? Could physical therapy, targeted injections, or gradual strengthening offer the same benefits without risking months of recovery? Sometimes the smartest decision isn't the one with the biggest action. It's the one that honors your body's limits, that keeps you moving safely without paying a hidden toll. Decision number 3: aggressive cancer treatments in older adults. Cancer terrifies everyone. When you hear the word, your instinct is immediate. Cut it out, attack it, do everything possible. And I understand that instinct. I felt it myself watching patients confront their worst fears. But here's the brutal truth most people never hear: the most aggressive treatment can sometimes steal more life than the disease itself. Take the Whipple procedure, one of the most complex surgeries for pancreatic cancer. Surgeons remove part of the pancreas, the small intestine, the gallbladder, and the bile duct. 6 to 10 hours of precise surgery requiring stamina and an entire team. For a healthy 50-year-old, it can be life-saving. For an 80-year-old with heart issues or mild kidney dysfunction, it can become a ticking time bomb. I remember a patient, 79, sharp, witty, loved his grandchildren. 3 surgeons told him surgery was the only option. Technically, he could survive, but the risks were devastating. Infections, organ failure, extended ICU stays, post-operative cognitive decline. He might have lived 6 more months or not at all. That's not pessimism. That's the data. 1 in 5 elderly patients undergoing major resection experiences failure to rescue complications. Their bodies cannot survive. The question almost nobody asks: if I don't operate, what other paths exist for someone my age and health? Radiation, targeted therapies, watchful waiting, all may offer years of quality life instead of months trapped in hospitals, weak and frail. Cancer doesn't have to be a battle where the body pays the full price. Sometimes the wisest decision is choosing a strategy that protects life, not just attacks the tumor. Decision number 4: aggressive preventive screenings in frail older adults. Routine screenings feel safe. Colonoscopy, full body scans, even extensive blood panels, they're supposed to catch problems early. Everyone tells you it's just preventive, it's for your own good. Sounds logical, right? But for frail patients over 75, these procedures can trigger serious complications that no one talks about. I've seen it too many times. A 77-year-old woman, careful with her diet, active in her community, scheduled for a routine colonoscopy. She seemed healthy until the prep, and sedation taxed her kidneys and heart. She ended up in the hospital for a week with dehydration and confusion. Another patient, 82, went for a full body scan. The procedure itself was fine, but the follow-up biopsies, false positives, and anxiety fractured months of her independence and peace of mind. Here's the brutal truth: in older adults, more testing isn't always better. The body doesn't bounce back the way it used to. Sedation contrast dies. Even minor interventions can tip the balance from stable to critical. And yet, most patients never hear that question. Is this procedure actually beneficial for me at this age and health status? Sometimes the safest decision is to pause, to weigh the value of information against the risk of harm. Preventive care isn't bad, but for frail older adults, it must be personalized, not rushed, not routine, thoughtful, cautious, and brutally honest. Decision number 5, emergency abdominal surgery. This one isn't planned, it hits fast. A ruptured appendix, a perforated bowel, internal bleeding, sudden, terrifying, leaving almost no time to think. And here's the brutal truth most people don't understand. For patients over 75, emergency abdominal surgery carries some of the highest mortality rates in medicine. We're talking 30 to 50% in severe cases, not because surgeons are careless, far from it, but because an older body under sudden trauma is fighting on every front. Heart, lungs, kidneys, liver, all taxed at once. I've seen it countless times. A man in his late 70s arrives in the ER with severe abdominal pain. The scan confirms a perforation. Surgery is urgent. He survives the operation technically, but days later his kidneys fail. His lungs struggle and his mind drifts in confusion and delirium. Weeks of rehabilitation follow. Months of independence vanish. A sudden routine-looking emergency becomes life-altering and our life-ending. Here's the point most families don't hear. Knowing the risk before it happens is, life-saving. Conversations about advanced directives, realistic outcomes, and what quality of life truly matters aren't morbid. They are essential. It's not about fear, it's about control and preparedness. Before any emergency strikes, ask yourself and your loved ones tough questions. What outcomes are acceptable? Which complications are deal breakers? How much intervention is truly worth it for life quality? These discussions can't happen in the panic of a hospital corridor at 2 a.m. They have to happen before the crisis, so that if your body is under attack, your wishes guide the care, not assumptions or protocols. Early recognition is key. Persistent abdominal pain, bloating, changes in bowel habits, never ignore them after 60. Seek assessment early. Intervention in a controlled setting drastically reduces the hidden risk. And always have a clear plan with your family. It can literally save the life and dignity of someone you love. Now that we've gone through the 5 medical decisions that seem right but carry hidden risks, let's talk about what you can actually do with this information. Knowledge alone isn't enough. Without action, it's just fear. And the last thing I want is anxiety without control. First, ask the right questions before any major medical decision. Don't settle for vague answers or everyone does it this way. Write them down. Ask your doctor, what happens if I don't do this? Not in theory, not in average statistics. For me, right now, if the answer is nothing urgent in the next 6 to 12 months, you have time to think, get a second opinion, or optimize your health. Is there a safer or less invasive alternative? Medicine has changed drastically in the last decade. Treatments exist today that didn't exist when your parents were your age. Catheter procedures, targeted therapies, guided physical therapy. Ask, demand, explore. What will recovery really look like for someone my age and health profile? Not the average patient, you, your heart, kidneys, medications, living situation. The answer should be precise, not generic. What is your personal complication rate for patients like me? Surgeons track this. They know their numbers. If they hesitate or avoid the question, that itself is a red flag. These 4 questions are your shield, your control, your way to avoid becoming one of the cautionary tales we discussed. A medical recommendation is not a verdict. It's the start of a conversation, and the person with the final say is you. Let me tell you about Elaine, a 72-year-old retired teacher, sharp, active, independent. She'd been told by her cardiologist, orthopedic surgeon, and even her family doctor to undergo aggressive treatments. Each recommendation looked safe on paper, but Elaine had seen friends her age go through procedures and come out changed. Not better, just frail, exhausted, sometimes worse. We spent 45 minutes reviewing her history, medications, daily routines, and what mattered to her most. And then I asked one brutally honest question. If we do everything you're being told is safest, what life do you actually get to live afterward? She paused. Then she told me being able to walk in her garden every morning, play with her grandchildren, read her favorite books without pain or confusion. She didn't want a checklist of procedures. She wanted her life. Together we built a plan. Avoid one high-risk surgery, replace another with targeted therapy, and emphasize personalized physical therapy. Not easy, not default. But the result, 2 years later, Elaine is stronger, walking farther, living fully, and still herself. Your age is not a weakness. Your body might be older, but your mind, your choices, your voice, they are yours. Every doctor's recommendation is not a verdict. It's a starting point. You have the right, the responsibility, Trussell, to ask the hard questions, request alternatives, and take the time you need. Your choices made with full knowledge and clear eyes are the most powerful tool in medicine. You hold it, not the prescription, not the test, not the procedure. You. And one last thing, if anything I've shared today helps you think more clearly, share it with someone you love. That one conversation might be the most important thing you do today. Stay alert, stay curious.